You know that moment. You have only been awake for about 30 seconds. The room is still dark. And before you can even think about getting up, you already know. Because your knees are telling you exactly how this morning is going to go. That deep, heavy, dull ache deep inside the joint. The stiffness that makes your knees feel like they were welded shut overnight. You slowly sit up, swing your legs to the edge of the bed, and then you stop. Because you know what is coming the moment your feet touch the floor. That first step, the worst step of the day. And the worst part is not even the pain. The worst part is that it happens every single morning, without exception. You have tried pain relievers. You have tried keeping the room warmer. You have tried those knee sleeves that promise to help. And every morning, it is the exact same thing. At some point, you just accepted it. My cartilage is worn out. My joints are old. This is just what my mornings look like. I have heard those exact words from hundreds of patients, and almost every single time, it is not true. Here is what most people do not know. Morning knee pain, that signature stiffness right when you wake up, is not caused by worn-out cartilage. It is not because your arthritis got worse overnight. It comes from something that happens to your knees while you are sleeping. Something that takes only 2 minutes to reverse while you are still lying in bed. Not after you get up. Not in the kitchen over your first cup of coffee. In bed. Before that very first step tonight, I am going to show you exactly what to do. And tomorrow morning, you will feel the difference. So, what is really going on inside your knees while you sleep? Your knee joint is enclosed by a membrane filled with synovial fluid. Think of it like the oil inside an engine. When you move around, that fluid is distributed evenly across the entire surface of the joint, lubricating every single contact point. When you lie still for 7 to 8 hours, that fluid settles in one place. The membrane surrounding the joint shrinks slightly. The surrounding muscles cool down and shorten. So when you wake up, your knee is not actually broken. It is just unlubricated. It is a cold engine, not a broken engine. The mistake most people make is trying to push through that pain. They get up and walk around on an unprepared joint, which actually increases the wear and tear on your cartilage and teaches your nervous system that morning equals pain. The right way is to warm up the engine before you start driving. And that is exactly what these 2 minutes do, before your feet ever touch the floor. Now that you understand why, let me show you what to do. Tonight, before you go to sleep, I want you to watch this entire video and memorize the sequence. It only takes 2 minutes. We have 4 movements. All of them are done while lying in bed. No need to get up, no need to get on the floor, and no equipment is required. The first 2 movements warm up the synovial fluid and release that shrinking joint capsule. The next 2 movements activate the muscles that support your knees before you bear any gravity. And at the end of the video, I have a bonus routine to do right before you close your eyes tonight, which helps prepare your knees for a better morning even before you sleep. Stay until the end. The order of these movements is very important. Skipping even one exercise will change the results. Exercise number 4. I call this one the slow pump. Lie flat on your back in bed. Stretch both legs out straight. Let your arms rest naturally by your sides. Slowly bend your right knee, sliding your heel along the surface of the bed toward your buttocks. Stop at whatever angle feels most comfortable. Do not force it too much. Then slowly straighten it back out. Repeat this 10 times. Slow, smooth, and intentional. After that, switch legs. Going slow is the main requirement here. Not because this is a gentle exercise, but because speed defeats the purpose. You are not building muscle here. You are moving synovial fluid. Think of it like slowly tilting a snow globe. You want every surface to be coated evenly, not violently shaken. Each slow bend and extension delivers fluid to a different part of the knee joint. I want to tell you about something that made me stop in my tracks when I first encountered it in my clinic. I had a patient, a 71-year-old retired teacher, who had been taking prescription anti-inflammatory medication for morning knee pain for 4 years. 4 years. I asked her to do this exact one movement every morning before getting up. 6 weeks later, she called the clinic and asked if she could start tapering off her medication. That was not a coincidence. That was synovial fluid doing its job properly. If bending your knee causes a sharp pain, just reduce the range of motion. Even a very small bend done slowly 10 times is enough to start moving that fluid. Start where you are, not where you think you should be. 10 times for each leg. 1 set, slow and intentional. Exercise number 3. The pillow press. Still lying on your back. Roll up a pillow or use a rolled-up blanket and place it under your right knee, elevating your knee about 6 to 8 inches, which is about 15 to 20 centimeters above the surface of the bed. Press your knee down into the pillow as if you are trying to push right through it. At the same time, straighten your lower leg up. Hold for 5 seconds. Release completely. Repeat 8 times. Switch legs. The pillow is not there for comfort. It is for positioning. By placing your knee at this angle and activating your thigh muscles against resistance, you are doing 2 things at once: warming up the muscles that protect your kneecap and drawing warm blood into the synovial membrane. Warm blood into a cold joint. That is the mechanism. No pillow. Use your other leg as a support. Gently cross your ankles and press down. It is just as effective. 8 times for each leg. Hold for 5 seconds each time. Before we get to the 2 most important movements, if you have been dealing with morning knee pain for more than 6 months and no one has ever explained this synovial fluid connection to you, go ahead and hit that like button right now and write the words morning knee in the comments section below. I read every single comment, and those comments let me know that I need to make more videos like this one. Exercise number 2. The gravity-free bend. Lie on your side, whichever side is more comfortable. Keep both knees slightly bent in a gentle fetal position. Pull your top knee up, drawing it as close to your chest as possible. Hold for 3 seconds, feeling the stretch in the back of the knee joint. Straighten it out completely, as straight as you can go. Hold for another 3 seconds. Repeat 12 times. After that, flip over to the other side and repeat. Lying on your side completely removes gravity from the equation. Your knee can now move through its full range of motion without bearing any weight, which means the joint capsule is fully stretched in both directions. This is the movement that signals to your knee. Today is a day for movement, not a day for pain. You are resetting the signal before you ever leave your bed. If pulling your knee to your chest feels uncomfortable, just go halfway through the range of motion. The important thing is the direction of the movement, not the distance. 12 times for each leg. 1 set. Exercise number 1. The most important one. I call this one the final activation. Sit up on the edge of the bed. Let both legs hang down, either touching the floor lightly or dangling. Straighten your right leg out, completely straight. Squeeze your thigh muscle, feeling the muscle right on the inside of your knee tighten up. Hold for 7 seconds. Lower your leg slowly. Repeat 8 times. Switch legs. Then stand up. This is the last thing your knees need before bearing weight. The muscle you just activated, the vastus medialis obliquus muscle, or VMO, which is the teardrop-shaped muscle on the inside of your thigh, is the primary stabilizer of your kneecap. When it is cold and inactive, your kneecap misaligns slightly every time you take a step. That misalignment is exactly what causes that grinding sensation in the joint. 7 seconds of activation changes that. You are no longer standing up on a cold engine. If sitting on the edge of the bed is difficult, Perform this movement while still lying down, using the exact same extension, the exact same squeeze, and the exact same 7 seconds. 8 times for each leg. Hold for 7 seconds each time. Then stand up immediately. And this is what usually surprises people the most. Tonight, right before you turn off the lights, sit on the edge of the bed one more time. Place both hands right above your kneecap and apply gentle but firm pressure, not directly on the kneecap, but right above it. Hold for 15 seconds. Then move your hands right below the kneecap and hold for another 15 seconds. You are not massaging. You are compressing the soft tissue around the joint, which gently pushes fresh synovial fluid into the joint cavity before you lock your knees in one position for 8 hours. Think of it as topping off the oil before you park your car overnight. 3 of my patients who added this single step to their routine reported that their morning stiffness began to improve within 4 days, not 4 weeks. 4 days. The sequence is vital. Perform the reset routine before bed tonight and do the in-bed exercises tomorrow morning. That combination is what breaks the entire cycle. Before you go, I want to ask you a question. Which knee is worse for you in the morning? The left, the right, or are they both the same? Please write your answer in the comments below. Left, right, or both. I read every single comment, because your answers change what I recommend next, whether it is about balance, sleeping positions, or something specific for single-sided knee issues. Your response helps me, and it helps everyone else watching this video. Please write your answer below. I read every single comment. That first step in the morning, the one you are currently bracing yourself for, does not have to be the worst moment of your day anymore. 2 minutes. In bed. Before your feet touch the floor. The engine just needs to be warmed up. And now you know exactly how to do it. You have carried this body for so many years. Now let us take care of it. Move well. Age well. See you in the next video.